Pain with standing and walking and upright postures is a common complaint that we see. Today we're going to be going over 3 basic exercises that you can do to help with this, and maybe 2 things that you probably should avoid. Let's get started. So we have Hallie here who has some pain with walking and prolonged standing. Typically, if someone comes in describing these type of symptoms, they'll have some pain when we assess their extension. So forward or backwards bending will typically be painful. So the first thing we want to do is see if we can find some movements moving away from that direction that provide some relief. Especially if we have pain with arching the back, but rounding the back feels good, we want to move away from that painful direction. So in this position, I'm going to get Hallie to move her hips back towards the heels, keeping the hands in the same place, and try and go back as far as you can. And as you do that, really try and relax into the movement. So you can see here that Hallie is quite stiff in the lower back. We want to almost trying to create like a rounding, a hunch, an arch through that area of the back, and then come back into the starting position, and then going back again. So hips back towards the heels, and really allow this part of the back to round. Good, and then back to the starting position. So we can also use a cat-camel or cat-cow position to move away from that painful direction. So unlike if we have pain with sitting or flexion activities, we'd focus more on the extension part of the movement. In this case, we're trying to get a little more flexion. So we would do the pelvic tilt in the opposite direction for me, Hallie. So coming this way, good, and on the way back down, we'd only go sort of halfway, just to there, just through a pain-free range, and just repeating that part of the motion. So the next exercise, we're facilitating that sort of flexion movement, moving away from the painful direction, but we're also getting a little bit of abdominal contraction at the same time. So I just want you gently engaging the abdominals and try not to lift the hips up there, Hallie, just keeping the buttocks in contact with the ground. Yes, exactly. And just roll back like so. You may want to progress that to a slight bridge, so keeping in that position and then actually lift up, but don't go too high. If you have some pain with extension-based activities like walking and standing, you'll probably find that at some point, if you lift up too high and get into an arched position with the back, you'll start to experience a little bit of pain, so we don't want to go that far. Good, and then come back down. So some things that are probably not the best to do. If you do have some pain going backwards, going into extension, and it feels like you might want to push into that, like pushing on a sore tooth, it sort of feels good. Especially in the acute stages of the injury, it's probably best that you avoid moving into that painful direction. So Hallie, if you put your hands on the hips and move back, if you do notice a little bit of pain with that, and especially if you do that repetitively and it gets worse, then let's hold off on that until the symptoms subside. And the other thing that's usually not the best to do in most cases of acute lower back pain is a rotation stretch. Now, sometimes if you have if you have pain with twisting and rotation, we can sometimes move in the opposite direction. But as a general rule, a lot of spines, especially in acute stages of painful conditions, are sensitive to rotation. So a movement such as bringing the leg up and across the body like this, again, you might get that sort of sensation of pushing on a sore tooth. It sort of feels nice to reproduce the pain, but it's something that may actually flare things up. So as we said off the top, this isn't to be considered medical advice. If you do have moderate symptoms or symptoms that are worsening or progressing over time, please do see your physiotherapist or doctor. If it's just a mild soreness and you're looking for some ways to try and relieve the soreness, give these exercises a go, and also try and avoid some of those stretches that whilst they may feel good at the time, may actually be provoking the symptoms. As always, thanks very much for watching, and please don't forget to like and subscribe for more fitness training and rehab information. We'll see you on the next episode.